The Ministry of Health had in February this year sent an emergency response team to Borno State in collaboration with the state government and other development partners to intervene in the nutrition crisis that rocked the internally displaced persons camps in the state. About 4 months on, the Minister of Health and representatives of the World Health Organization are back in Maiduguri, the state capital, to assess the impact of the intervention. After a tour of some of the medical facilities handling the intervention and a visit to some IDP camps in the state, the WHO country representative expresses satisfaction with the level of implementation.
And this is a midterm review. What I observe is that the work is going on well, as expressed by the Honorable Minister of Health. So that's what I witnessed. Over and above, also, partners are also about 21 partner agencies coordinated by the states are also providing integrated services.
On his part, the Minister of Health speaks on how important the intervention is to the federal government.
As you know, nutritional problem is a major issue, and we want to make sure that people are well fed. When you are well fed, we jokingly among ourselves say that we are also investing in cerebral architecture.
He also gives reasons why the program needs to be extended.
The drug that we brought to Borno is active for 2 years, and we are quite confident that extending it will not be as expensive. We will not have to buy new ambulances, new delivery trucks, we will not buy new drugs. What we need is to keep the personnel human resources going.
The Northeast Health and Nutrition Emergency Response is targeted at caring for the medical and nutritional needs of the IDPs, especially the young children who are at the risk of dying from malnutrition.